But before we leave this topic,
Yes.
doctor, this explanation,
Yeah.
imagine there is blockage into the vessels now.
Yes.
And this little child is feeling a lot of pain.
Yes.
What can a mother do?
Oh, yes. So if a child is already a sickler, the mother should know about this. This, what we have described, is called painful crisis.
Yes.
People who are sicklers do get different types of crisis. One of the commonest is called a painful crisis.
Okay.
Now, the painful crisis, in most cases, is because of this mechanism. One, you need to manage the pain. You have to give painkillers, because if you don't manage the pain, it's going to, the child's reaction to the pain is going to make the situation worse. Okay? But the other thing is, you need to know that this child can easily get painful crisis, and you pay attention to things which can easily predispose to this. One of them is dehydration. You have to make sure the child is always hydrated, because if this blood is not so thick, as it happens in dehydration, somehow the blockage will not be so much. So the child should always be hydrated. Drink as much as possible. But the other thing is, you should make sure any slight infection, like chest infection, urinary tract infection, needs to be treated as early as possible, because that is it. That's not a child where you're going to say, no, this is just flu. No, because the next thing may not be good. And you have to pay attention to other forms of the child's health. In some people, I have seen, they can even get this crisis because of stress. You know, if the child is stressed, so you have to follow and understand the child's condition, even in the school. In the school where the child is going, you have to understand how they're interacting, what is the environment. It's your duty to make sure. It's your duty to make sure you prevent occurrence of this crisis. Yeah.
I have a lot of questions there, but let's first go into other questions. We shall come back and look at sick cells. Doctor, now let's go to IVF.
Yes.
Is it possible that when you're doing all this IVF process, you can detect an abnormal genetical transmission? For example, sickle cell, as it is our case study.
Yes.
And then you pick it away and you give the couple a normal cell that does not contain that.
Yes, precisely.
How do you do that?
Precisely, that's what happens in IVF, actually.
Okay.
And it's a very big role of the IVF treatment. Yeah. So what we do is, you know, the sickle cell, we advise them to do IVF. Because for people who are carriers, this gene of sickle cell, there are two forms of this gene. Like any other gene, genes are usually occurring in pairs in our bodies, you know, for controlling a particular characteristic. They occur in pairs. So in people who are normal, both genes are normal. Both genes are normal and they have no problem. In people who are carriers, one of the genes is for sickle cell and the other gene is the normal one. Now the normal gene works very well, and most people like this don't show symptoms. Those are called carriers. Now, for those people who have sickle cell disease, both of genes are sickle cell, they are abnormal, and so they will have the disease and they will have the symptoms. Now, for the case where people are carriers, this is where the problem is. They don't have symptoms, but they have the genes. Half of the genes, one gene is abnormal and the other one is normal. Now, when two people who are carriers meet, they have a chance of about 25, we'll illustrate later, about 25% chance of getting a child who is a sickler. And now this is a problem and you need to avoid it. Yeah. So what we do in IVF is we do IVF where we remove the egg of the woman, we remove the sperm of the man, fertilize the egg. In essence, we are mixing the genes.
Okay.
Each sperm comes with one copy of each gene. Yes. So some sperms will come with the sickle cell gene, others will come with the normal gene. Then for the egg, it is the same. Some of the eggs will come with sickle cell gene, some of them will come with the normal gene. Now, they will mix up. Those with the sickle cell gene, some of them will meet still. So that is sickle cell. Others will be carriers. Others will be normal. Yes. So in IVF, after the fertilization, this is the mixing, we are able to test. We are able to test the embryo and know that this one has no sickle cell. This one has sickle cell gene. Now we will pick the ones which don't have sickle cell and put them in the womb of the mother. And the mother has a baby without sickle cell.